Did you know that this June is Cataract Awareness Month? So the reason why Cataract Awareness Month is important is the formation of a cataract is something that is going to affect every single one of us at some point in our lives. This is when the lens in the eye becomes opaque and begins to block the amount of light and color coming into the back of the eye, so images become blur and degraded of contrasting color. It is officially the most common operation in the world, and it's something that can impact all of us from our day-to-day lives to our jobs, our holidays, and time with our family and friends. One of the first things people can do is obviously get information from the internet. Our website in particular provides a lot of information where you can contact people and we can get basic information what a cataract is and how to be treated. Your local optometrist or optician can often provide a point of contact to get information, get a basic understanding. So the most common contributing factor to a cataract, unfortunately, is just natural aging. Everyone's lens when we're born pretty much starts out crystal clear, and as each year goes on, those proteins or those structures that make up the lens become affected with age, and eventually they become opaque, and then you don't have a clear lens anymore. So the main risk factor would be age, and of course there are other kind of recognized risk factors such as sun exposure, trauma, smoking, bad diet, things that we probably all know to avoid, but have an impact on the development and speed in which a cataract forms. Cataracts are usually diagnosed by the patient themselves reporting a decline in their vision. Usually they might notice problems driving at night in particular, or having troubles reading or watching TV, or even in extreme cases finding themselves having accidents or making mistakes around the home or at the workplace where their vision has slowly been deteriorating. So the patient will come in with these symptoms, and we will then look on what's called a slit lamp, which is a special microscope, and we will look directly into the eye, and we can tell very, very quickly whether a cataract is present or not, and how dense and how developed it's become. Cataract surgery is probably the most effective and efficient surgery we can perform on a human being. It involves the removal of the cataract, which is the opaque lens, and then essentially injecting a foldable crystal clear piece of innate plastic into the eye, which allows for a lot of more light and color to come into the eye with a clear focus. Surgery usually takes around 15-20 minutes, and then that lens sits in the eye for the rest of your life. So the surgical procedure itself is efficient. You'll come in, you'll get local anesthetic, so you won't feel or see anything. You come in, you lie down, you're covered up, and then the surgery itself takes about 15-20 minutes, and then we'll put a patch over the eye, which you can usually take off the same day or the next morning, and then we'll see you usually within a week's time and provide you with some post-operative antibiotics and steroid drops to help with your recovery. Well, the good news about cataract surgery is usually the visual benefits are experienced extremely quickly. Many of our patients who come in with medium or high density cataracts will often report the results or the benefits of that lens surgery the very next day. And then over the next few days and weeks, the vision becomes sharper and sharper. So almost 24-48 hours, you'll notice the vision improvements. So the procedure is a totally painless procedure. You're given local anesthetic, which basically stops the eye from moving and also stops kind of light impulses getting to the back of the eye, so you don't really see much either. And then you're covered up, so you don't see anything, you don't feel anything. And by the time the procedure is finished, many patients didn't even know it started. In our clinic, 9 patients out of 10 are within the driving standard the next day. And we have many patients who return to work usually within a few days. We do advise on reduced strenuous activities like heavy lifting or excessive movements of the body and the head, but generally people can resume a lot of their day-to-day activities within just a few days. So in terms of the most important factors for a successful recovery, number 1 is obviously take your drops, your antibiotics and your anti-inflammatories. Don't overexert yourself. But then it's really just a case of the body doing what it does best after this type of procedure, which is heal itself. and then obviously get used to the idea of not having to wear glasses anymore for either distance, near, or both tasks. So as cataract surgery is already an extremely efficient and accurate surgery, the developments are really just progressing from good to excellent. And the main area of development has been in lens technology. This is basically essentially when we replace the cataract, putting lenses in the eye that can give you clearer and clearer vision, but also vision at different distances. So to basically make it so you don't need to wear glasses anymore. A multifocal or an extended depth of field lenses have become very popular over the last 5 to 10 years. So in terms of preparation for the surgery, you'll obviously come and see your surgeon. We will talk you through everything you need to know. We'll explain the procedure, we'll explain the aftercare, we'll go through the consent form very thoroughly, and then it's really a case of we'll give you some drops to use maybe on the day of the surgery. You'll come in as normal, lie down, probably takes about 15-20 minutes, and then you're out the door once we've given you your post-op letters and discharge information, and then we'll usually see you again in about a week's time.